Hello, good evening, and welcome to the Functional Solution class and podcast, where we dive deeper into the root causes of epigenetic drivers of chronic diseases and share practical strategies that you can use to better support your patients. So, if you're interested in understanding why patients continue to struggle despite standard of care and how to address those gaps, in care, then you're in the right place. And my name is Tal. I'm the Educational Director at the American Academy of Functional Health. And with us, we have Dr. Kim.
Hello, everyone.
And Dr. Kim just shared with me that they're getting lots of snow, which it sounds like fun. It sounds like the magical Christmas that we all.
Yes, it's very snowy. So it's a very festive feeling.
Yes, which is incredible, and we get that sometimes in the Northwest in January. Sometimes we get that in January, like after Christmas. But it sounds like a lot of fun. So hopefully, all of you, wherever you are, you're in a warm and cozy place at home, and you're watching us now, learning more about functional and integrative medicine. And I wanted to bring Dr. Kim here because Dr. Kim has years of experience and she's in primary care. She has an amazing background. She you were an exercise physiologist, right?
Mm-hmm.
Started as a physiologist, was a nurse practitioner in primary care, been in healthcare for over like 20 years or 30 years, something like that?
Close to, almost 30 years, because 1998 is when I started.
Yes, that's amazing. That's
I won't say
amazing.
my age. I'm old enough.
Well, you look amazing. So
I'm
the
50.
functional medicine probably works for you really well.
Yeah, it does.
So of course, Dr. Kim has so much experience, vast experience with patient care, and also she's one of our graduates in the Advanced Functional Medicine program, and she's doing amazing. She's been also a professor in one of the which university is that, Dr. Kim?
I was at University of Minnesota for about 3 years, and now I'm over at Metro State University, and that's part of the Minnesota State school systems. So I am in their DNP FNP program.
Oh, cool.
And so I'm teaching people how to be nurse practitioners in family practice, and we have integrative focus. So it's pretty cool.
That's awesome. So it's amazing that you can take everything you have learned over the years and everything you learned in our program and just apply it into your practice, share it also with other soon to become nurse practitioners, right? That if I understood the program properly.
Yep.
So that's incredible. And Dr. Kim has an amazing case study she wanted to share with all of us today. So today we're going to do a case study on chronic fatigue and depression through the functional integrative medicine approach. And of course, Dr. Kim's practice is primary care that integrates functional medicine and integrative medicine. So you'll get to see what it looks like when you learn functional medicine and apply it. And so we got some really cool information that we wanted to share with you and some lab results that Dr. Kim has brought. So that's going to be a lot of fun. And then, of course, I always want to start with, we got in our community, we have lots of nurses, nurse practitioners, physicians who are coming in, pharmacists, PAs coming into, and other professionals like doctor of chiropractors and sometimes acupuncturists and other professionals, and they want to advance their skills. And I always start with mentioning why is it that these professionals will start with or get into or learn functional medicine, right? And of course, the first one is we all know anxiety and depression is increasingly prevalent. Mm-hmm. I've seen a lot of those patients. I'm sure, Dr. Kim, you've seen a lot of those patients in your practice as well.
Probably, yeah, like maybe 30% of my patients have anxiety and depression, and that's probably being pretty conservative on that estimation.
Yes, it's very interesting that I've seen patients that come in. I've seen some patients like they either come in and they say like, that's my chief complaint.
Yeah.
And interestingly, on the other side of it, there's like patients that come in for like arthritis or or headaches, or they come in for something that, like a certain primary concern, but then over time they're like, oh, you find out they also have anxiety, depression, they struggle with mental health. So it's unfortunate. It's so common. I think with chronic disease, if you're a patient struggling with chronic disease or pain or fatigue, I think it will at some point impact your mental health, right? So that's one part of it. The second reason is many patients are prescribed with SSRIs or other psychiatric medications, yet they continue to struggle with these persistent symptoms, right? Either low motivation, depression, anxiety. We had once a patient she was on 4 different medications and she was still struggling, right? So they have no other choice but to go to somebody like you that understands the mainstream, but also can see the whole picture with functional medicine, and maybe have some more strategies that you're going to share about today with integrative medicine, which is really cool. And then of course there's side effects, right? We know the potential side effects of especially SSRI. So before we kind of get started, and Dr. Kim is going to present and share the case study, most of you already know this functional and integrative flow, and some of you even have done some coaching already with Dr. Kim, right? So we get some really good feedback. So
thank you.
So that's always amazing. And I want to share this quick picture or illustration of what it is that we do with functional medicine, right? This is essentially what the flow looks like. And it essentially looks like this. The patient comes to see you. We listen to their story. You do the medical review that you do. If you're a nurse or a pharmacist, you might do a health review, right? Lifestyle, look at occupation, other major concerns. And this is going to be different than the insurance model where we have maybe you have 7 to 10 minutes or 7 to 15 minutes. Here we really do a much deeper dive. Next to that, the second step is trying to identify what are the factors that contribute to or trigger the dysfunction. So we're going to go beyond the typical answer that I get from practitioners, which is it's in their genes or it's their age, right? We really want to understand what's going on there. What actually triggered those genes? And that's functional medicine. That's epigenetics. So by listening to this class today, you're already going to start to understand 2 of the major root causes. And of course, we also always use an evaluation tool that the Academy gives you lifetime access to, and you can just go into the clinical toolbox in the platform, make sure you download that, and then you can start using it. Give it to your patients. It'll show you when they fill it up, it'll show you the whole picture, what 2 or 3 major root factors you want to focus on. And then step number 3 is creating a health plan. So now that we know what are the 2 major root causes, like Dr. Kim is going to show you today, we want to focus on, then we utilize the quick start, the quick start guide or the clinical guide, and then for the root causes. And then we also have a phone app with all the treatment protocols. So you can just type in depression, you can type in type 2 diabetes or PCOS, whatever it is, and it shows you the treatment protocols. And then to educate, this is the last part. After you understand the root cause, you have a treatment plan, and you educate the patient into what they actually need to do. So you're going to see these 4 steps through Dr. Kim's presentation today or tonight, because it'll be a just really great example for what's possible when you just utilize these 4 simple steps. So Dr. Kim, anything you wanted to add to that, or you just want to jump into the case?
No, I love it. That's exactly the flow. and I've talked to a couple people too on coaching calls about, the flow of my patient approach versus maybe other clinics. And there's certainly different ways to do your business model, but whatever your model is, whether you do memberships or you do per visit fees, you're still following this process. So, to me, you're like a detective. You're collecting history from the patient, you're collecting lab work. And I always tell the patient, the first time I meet with you, I'm collecting your history. And then the next step is we need more data. So we're going to do lab work, and we're going to gather all this data and combine it and then come up with this plan of action. So I think that makes good sense to all of you guys. And that's, whatever business model you have, that's probably what you're going to follow still. So with that said, shall we go?
Yes, go ahead.
All right. So I am going to be talking to you guys tonight about a 22-year-old male. He came to me actually. His mother actually and him are very close, and his mother found out about me through one of her friends. So that's another way you're going to get patients, guys, is your word of mouth referrals are like your biggest advertisement sometimes. And so anyway, this patient came to me. The mother actually was really down because she said, we cannot find any way to get him feeling better. And, do you work with ADHD and anxiety and depression? And do you do something different than Western medicine? And my answer was, yeah, absolutely. I mix a lot because I do have a foot in primary care. But, functional medicine is the core of what we do. So here's his case. He's a 22-year-old male. He's diagnosed with ADHD, depression, and chronic fatigue. 10-year history of low energy, anxiety, low motivation, despite psychiatric treatment and normal routine labs. And when I say psychiatric treatment, I mean counseling, so cognitive behavioral therapy, along with medication management. So he's been getting both. He's got suboptimal sleep, very low physical activity, limited plant intake. And again, this prompted him to seek the integrative approach. So he basically, as far as medication goes, he was taking Wellbutrin, extended release, and methylphenidate. So he was taking the bupropion, Wellbutrin for his anxiety, depression. He was taking methylphenidate, extended release for the ADHD. So he's riding a little bit of a roller coaster with that. And the psychiatrist had also given him some as needed anxiety medication too. So whenever I see that, I get this almost cognitive dissonance because you've got uppers and downers and in-betweeners that these patients are on. And I know a lot of you are probably nodding your heads. Yep, we've seen it. So for anxiety, we're going to give them, something like Boost Bar to just calm them down. Then the Wellbutrin for the underlying everyday anxiety, depression. Then let's give them a stimulant for the ADHD. So, when does it stop, this cocktail of medicine, and when do we get to the root cause? So let me jump ahead here. I'm going to go down to, so I saw him, we did a good intake. And he did tell me, he's been very fatigued and depressed really for about a decade, really, just constantly feeling tired, lacking motivation to complete tasks, feeling down. And one thing I have to say about somebody that you're seeing, this day and age, now this was technically about a year and a half ago. This is someone that had their teenagers disrupted by the pandemic. And I think that's another just side note. Remember, that's such a stressor that was a big stressor on the world, right? Can you imagine if you're a teenager and you go through the pandemic? I think that was a huge stressor for a lot of our teenagers. And now they're hitting 20 somethings and they're paying the cost. It took a toll on them, right? So again, he's never been to functional alternative medicine. He's just been to psychiatry, getting the normal cocktail of things. It's not working. Preventive care. So he had a physical about a year before he came to see me. And his labs really about a year ago showed no concerns. His last preventive tests were, really just lab work because he's young. He sees a dentist regularly. He gets regular vision exams. He's got resources. So he's got health insurance. He has a roof over his head. He's a student. He has a college student, and he works. He is still living at home with his parents, or he was when I was treating him. But, functioning. It's not like he wasn't functioning. He just didn't feel good, and not getting through life the way he wants. As far as a physical picture of what he looked like for you, he's about 5'11", very thin. He was 137 pounds, BMI 19.11, no history of abnormal blood pressure or pulses. For his lab workup, so his history. So let's back up, right? The steps of an intake are the history. And I'll get to what the functional medicine tool showed as well. And so that's what I do first. So I'm going to jump down to the functional medicine tool to kind of show you my recipe. So I do all the history, and then I'm going to jump to labs. So the functional medicine tool showed me this. Remember, this is still history, subjective information we're taking in. He has, as far as physical activity, no regular exercise routine, occasional yoga and stretching only. That's all he was doing. Low plant intake, maybe 1 to 2 servings a day. Approximately 10% of his diet is from sweets or processed food, mixed with some organic food consumption. So organic foods, when I asked them, do you eat organic produce? Always, never, or a mix. He said a mix. His sleep averaged about 7 hours with difficulty falling asleep. So he just couldn't shut his mind off to go to sleep. Moderate stress with sporadic use of, he had some breathing techniques that he had gone over with his counselor, a little bit of journaling here and there, but nothing that he was really solid with as far as those practices go. Hydration, he was, not tracking anything. He's like, I don't know how much water I drink. I don't really pay attention. I tried to drink water, but I couldn't tell you how much. So that's very common when people, are coming to you and they're first taking their foot into functional medicine and wellness. A lot of them don't track their water. And then as far as environment and preventive care, he had minimal environmental or occupational exposures, because we have an intake that asks all about that. He did live in a home built before 1978. That was really the only risk factor. But he had a routine medical care up to date with all of that stuff. So one thing I can tell you too about his nutrition is I almost felt like he was really under eating. He's quite thin, 5'11" and 137 pounds in a male 22-year-old. So, I asked him, I said, do you have trouble with appetite? Do you, when we were on the nutrition subject? And he really didn't have the best appetite either. So I feel like he was probably under eating quite a bit. So lots of data that we pulled in. I did a PHQ-9 and a GAD, and those are screening tests for anxiety and depression. And he scored moderately high on both. So he wasn't at goal on the medications he was taking and the plan he was with the psychiatrist he was seeing in the counseling. So now I said, let's collect a little more data. So I drew just some normal standard well labs on him. And I will tell you, if you're not, a provider that can order labs per se, we use Ulta Lab at my clinic. And that is one lab where the patients can go order their own labs. There's several labs out there where patients can self-order, just so you're aware. Now, me being a nurse practitioner in a full practice authority state, and I do blended integrative primary care, I order them myself, but I just like to put that tidbit out there. He had a normal complete blood count. So red cells, white cells, platelets, fine. He had a normal metabolic panel. So liver function, kidney function, major electrolytes, fine. He had normal thyroid function, normal testosterone level, which I was kind of surprised-ish. I mean, he's a 22-year-old male. And so typically most of them are going to have in normal range testosterone unless we have something really crazy going on. His vitamin D was 48.9 and his vitamin B12 was 1085. Now the vitamin D, The sweet spot is 60 to 80 when we think about it, nanograms per milligram. So he wasn't quite in the sweet spot, but he was better than I thought. I'm like, wow. And then come to find out he had been taking a multivitamin and a B vitamin, and that's why his vitamin levels were up. So he was like, oh yeah, well, I take these. And that came back after the fact that we did labs. And his vitamin B12 was 185. Again, went through that. Now that's a fine number. It's going a little towards the high zone. I mean, you don't want to get much over like 1100 truly, because then you start running into issues with too high of B12. And you can see that sometimes with folks that overconsume energy drinks that are locked and loaded with B vitamins, and they're just drinking like several a day. So he wasn't doing much of that. He would have an energy drink here or there, but he really wasn't eating or consuming much. That was my problem. I think that was his issue that I was trying to dig deeper. I think the depression was causing him low intake of everything. I did check a prolactin level on him. Now, why would I do this? So the prolactin level has a lot to do with how the pituitary gland is functioning. And, it's good to check those things that are downward of the prolactin, downward of the pituitary gland or of the brain. So that those are things like the thyroid, the testosterone, all those hormones, adrenal stress profile, which we're going to look at. But I always check the prolactin if I'm going to be starting to look at all these hormones, because I just want to make sure there's no big red flags there with the pituitary gland. So those were the blood labs. So nothing really impressive on the blood labs per se. But where I found the really cool stuff was more in the next thing that we'll talk to you about. And that next thing we'll talk to you about, Dr. Tal's going to talk to you for a minute first on it, but it's the adrenal stress profile. And that's the test we did on him. And that was from Genova Labs. I like Genova Functional Medicine Labs, but there's a lot of other great labs out there. Our clinic uses a lot of Genova Labs. I really felt the adrenal stress profile and the Metabolomics Plus would give us a lot of good extra information that we aren't going to get from just the routine lab work. And patients can self-order at a lot of these places, just so you know. So I suspected that there was something going on with his adrenal HPA-axis because of the anxiety, the fatigue, and the sleep issues, and the extreme stress that he went through as a teenager, just going through that pandemic. So again, his formal diagnoses were ADHD, depression, and fatigue. And I'm going to let Dr. Tal take it from here and talk to you a little bit about the HPA-axis.
Yeah, thank you so much for giving us like an update and an overview of the whole case, because that, of course, helps everybody to understand where we are right now. So this is probably a challenging situation for many practitioners who might, at this point, if they're only trained in the standard of care, they might try to replace one medication for another, or just refer him to another specialist. You've probably seen that, you've probably seen it over and over again. I've seen it so many times where the family practitioner doesn't know what to do anymore with this patient. So, right. So we're going to dive into one of the first mechanisms, which Dr. Kim mentioned, the adrenal and HPA-axis. And we're going to do that because once we go back to showing you the lab, which Dr. Kim is going to share the lab results, we want you to understand what you're looking at and how is that related to, of course, his symptoms and clinical presentation. So let's take a look at this image. We created this image for you just to make it very visual. And so on the top, you can see this stress and then the HPA axis that Dr. Kim was talking about. So that's the hypothalamus, pituitary cortisol. And every time, essentially, we are stressed, stuck in traffic, something happens to us, some physical injury or a pain, or even small things like we got stressed due to a family member, or For some of our patients, that might be toxic relationship or events that happened to them in the past and they carry certain traumas. It could be multiple things, but could be also perceived stress, something that for you and I might not be as stressful, but it's perceived as high stress for some of our patients. So that activates our HPA-axis, which is hypothalamus, pituitary, and adrenal. And adrenal, at that point, will start secreting it'll trigger the fight or flight, but it also secretes cortisol. That's why you see the cortisol there in the middle. So let's take a look at some of these pathways. And essentially, these are the pathways that we refer to when we have a patient that have persistent stress, either chronic stress and chronic activation of the HPA-axis, which what you will see in the lab test when Dr. Kim is going to share with you the result is elevated cortisol. And that's what happened often where we have, every time we are stressed, we secrete cortisol. And you can measure that in the test. And Dr. Kim will talk more about that. But in a state of prolonged stress, our nervous system goes through, there's like 4 different steps, but it goes through initially through this adaptation to the stress. And that can directly influence our mood, our energy level, our different systems in our body. So let's go into the first sort of mechanism or pathway, and that's where you see on the left side. So on the left side, from cortisol, if you have ongoing cortisol, elevated levels of cortisol, it could directly interfere with the neurotransmitter system and brain regions that are responsible for the regulation of our mood. And so physiologically, you could have a situation in which there is an impairment of the signaling of serotonin. That is due to reduction in serotonin synthesis, altered serotonin transporter activity, and also reduced sensitivity of the serotonin receptor. So he might be taking SSRIs, but the serotonin receptors have reduced their sensitivity. So he's not getting the same response to the available serotonin. You might also have an impact on GABA. So cortisol can suppress the inhibitory GABAergic signaling, which lowers the ability of our brain to essentially self-regulate or calm itself. So you get like this inner anxiety sensation, anxious sensation. We also see some reports on impaired or disrupted dopamine signaling, which essentially is dopamine is one of our motivation neurotransmitter. And if you have reduced dopamine tone, then you essentially get this like sensation of low motivation, emotional flattening, or I like to call it like the flat effect, which the patient doesn't really care so much anymore about important things in their life. So they're just not motivated. So that could be one aspect that can contribute to anxiety and depression. There is, of course, a completely different test, neurotransmitter test that we teach in functional medicine, where you can indirectly get a measurements of like what would that look like. Like there are multiple neurotransmitters, and that something we sometimes utilize further if needed. In the middle section, you can see the middle arrow goes from cortisol. So that's another pathway. It's important to understand. This is cortisol, and this is how excess cortisol can contribute to chronic fatigue. So cortisol is intended to mobilize energy in the short term. So every time our body secretes cortisol due to stress, our liver turns on certain pathways that increases the release of glucose into our bloodstream. That's the process that's called gluconeogenesis in our liver. But we also have to remember that if that happens chronically, you're living on an elevated fight or flight or cortisol levels. Cortisol promotes catabolism in our body, which increases the breakdown of proteins and reduce the recovery of muscle. And it also have a very negative impact on our mitochondrial function. So prolonged cortisol exposure was found to be associated with decreased mitochondrial biogenesis and impaired oxidative phosphorylation, and which essentially, in other words, that energy factory in our cells is needed. It needs to work well, because if it doesn't, you're gonna see a decline in cellular energy production, in organ, in system energy, available energy for store systems. And that's where you get patients that are chronically fatigued. They show up in your practice and they're like, I just feel tired all the time. Now, of course, we're not going to get into cellular and mitochondrial dysfunction, but I want you to know that connection between like the adrenal cortisol secretion and the cellular function. Third is what we're seeing is the sleep and circadian rhythm disruption. So essentially, every time you got cortisol secretion, it's antagonistic to melatonin, which is important for healthy sleep. So every time you got cortisol increases, it also decreases your melatonin. So when you look at a patient's lab and you see that the cortisol is elevated, is higher than it should be, just know that it's probably disrupting their normal release of and synthesis and release of melatonin, and disrupt the circadian rhythm, because that's what cortisol does. Cortisol is supposed to be higher in the morning and very low in the evening, because that's where we're getting ready to sleep. That's where our brain is starting to get, and our bodily system starting to get ready for sleep. And of course, I know I'm oversimplifying things, because I want to make sure it's a lot of information that we're putting in like one class, right? But we have a whole class on each one of those branches, which is like 2 hours, just a 2-3 hours, just a deeper dive into each one of them. But if you see a patient that's having troubles falling asleep, have light restless sleep or morning fatigue, it could be one of those common reasons is that their HPA-axis just not working well, or they secrete cortisol. That could happen for multiple reasons. But now you understand how a disruption in the HPA-axis, over-secretion of cortisol, can interfere with all of those different systems, with the neurotransmitters, with this energy production, and our natural circadian rhythm. So now that we understand that, Dr. Kim is going to take us into what she actually found in this patient's lab. And Dr. Kim, probably important to mention that the comprehensive adrenal is different than measuring cortisol in the standard of care, which is a blood test in the morning, right? So you want to maybe, maybe mention a little bit about that.
Yeah, I see a lot of my Western medicine colleagues say, oh, we can check your cortisol, no problem. And it's a one-time spot check. Hopefully it's in the morning, but we're not really sure what time the patient woke up, right? So that doesn't really tell us the full story. And you're going to see exactly why, and like as probably a split second when I show you his lab, because I'm going to show you how we tested it throughout the day, because it matters when you wake up, and you should have a cortisol spike when you wake, and then that spike raises you up, and then your cortisol should stay nice and kind of high in the morning, and then you're going to start coming down slowly all day long. And we want to see that whole day's worth of cortisol to see if our patient is flatlining high, flatlining low, or are they just right, So if a patient's really high, then we worry about, oh my gosh, this patient's just, his cortisol levels are high. His adrenals are just spitting out cortisol all the time, all day long. And the thing that happens after they run out of energy and they just overwork, then it goes flat. So we caught him before it had gone flat. If it goes flat, then that's a whole another thing. Then you've really got full on adrenal fatigue, because the adrenals are so tired of spitting out cortisol, they're not going to spit out much more anymore. So, so let's take a look at his labs. Let's see. go to the, yeah, that's the one right there. So I hope you can see this. I'll make sense of this square. I know the numbers are really small, but the box at the far left is 7 a.m. to 9 a.m. And then their second point is 11 to 1 p.m. The next point, and this is going across the bottom axis, the left to right axis. The third dot is 3 to 5 p.m. And then the fourth dot is 10 to 12 a.m. Okay. And then the up and down axis is just cortisol levels. So when we look at the green is the cortisol trajectory that is our goal. Okay. So we want somebody to wake up. They'll have a little cortisol spike. You can also measure the awakening response if that's something you find extra helpful. I often do the regular ASP profile. Some people really like to see that awakening response, but I get quite a bit of good information from the test even without that. But with that said, green is good. So if you can see, the cortisol is quite higher in the morning. And then it comes down, that second hash mark, 11 to 1, it comes down, kind of almost looks like an arm, and that's the elbow, right? So it comes down quite a bit from morning to noon. So morning to lunchtime, you really start to dip your cortisol levels, and then they slowly dip down to their lowest in time for bed, which makes sense because cortisol, as Dr. Tao was saying, it will antagonize and kind of stop the effects of the relaxation response. So we want less of it at night when we're trying to go to sleep. Fun fact, this is why kids get more allergy symptoms at night and their fevers sometimes get higher at night. Cortisol is anti-inflammatory, right? It's our Mother Nature steroid, and it decreases at night. So often people with allergy symptoms or when they're ill, they'll feel worse at night because the cortisol levels naturally lower. That's a total side note. So the green is good, right? Then the yellow and the red are kind of danger zone of low or high. Now let's look at the black line here. This was my patient, and this is not good. So he started off the charts in the morning, high cortisol, and he's way above the red, see? Then he stays in that high zone. At lunchtime, he is still way higher than he should be. Look at the goal, all the way down. So second hashtag over, it's kind of where the elbow of the arm is. He should be way down there, and he's way sky high, right? Then at 3 to 5 p.m., okay, now it's dropping, but it's not dropping nearly where we want it. It's still way too high. And then at 10 to 12 a.m., so his bedtime measurement, he's still way above goal. So if you see where green is and you see where the black line is, you can clearly see his cortisol levels are way too high. And to me, I'm like, yep, this is kind of what I thought. And I will tell you, he is not the first 20-something-old male that I've seen recently with these issues. And we've had tests that look like this. So, I mean, these kids have been really stressed. The opposite of cortisol, think of the cortisol balancer in your body is DHEA, okay? Now, DHEA can serve a lot of roles. It can be actually very protective for your body and anti-inflammatory in a lot of ways. It can be cancer preventative. There's lots of great studies on it. It's important. It's just as important as the cortisol. These two are counterbalances. That's why they measure DHEA on this test as well. So his DHEA earlier in the morning was measuring quite high. And then it was measuring kind of the cortisol DHEA ratio was measuring kind of in that yellowish sort of high range. So what that tells me though is he is trying to keep up. His body is trying to spit out a lot of DHEA to keep up with all that cortisol, but it's going to run out soon. And that's how the whole thing works. And then once you go into full adrenal fatigue, that black line you see that's elevated is going to go lower. Okay. So he definitely, I mean, I'm like, well, we found something here, and it's very, very significant because guys, until you fix the hypopituitary axis, the HPA-axis, the hypopituitary adrenal axis, until you fix that, you're probably not going to be able to fix a whole lot of other things on your patient when they're dealing with things like fatigue and depression and anxiety, because these are the drivers, right? There are ways to fix it, and I will tell you how we worked on fixing his. We'll talk about the treatment protocols in a moment. I also want to show you the metabolomics results. And so that was, look at all that green. And so again, metabolomics is an extensive nutrition evaluation. It is through Genova Labs. Again, I like them. There's many other good laboratories out there. I don't have a vested interest other than I like them. It tests for several buckets. And I always tell my patients, we're going to look in 5 buckets with the metabolomics test, but they're like dominoes. They all affect the other. So if one is high, it might be because the other one's high. They're not siloed out, right? So we looked at oxidative stress, mitochondrial dysfunction, omega-3 or omega imbalance, and it looks at the 3s, the 6s, the 9s. And it really focuses on, is there a 3-6 imbalance? Toxic exposures and methylation imbalance. Now, with that said, he's in the green. I thought for sure I'd probably see something with maybe mitochondria. And no, he looks really pretty good. Now, remember, I told you he was eating somewhat healthy. In other words, he wasn't eating a lot of junk food. And he was taking a multivitamin and a vitamin D. And so the next graph I'll show you is a breakdown of his antioxidants and his B vitamins. So that really wasn't quite awful either. And that makes sense because we just looked at page 1 of that test. This is page 2. I love page 2 of the Genova Metabolomics because it breaks down this in such a nice, lovely way where you see exactly what antioxidant, if they're in the green, that's good. If they're in the yellow, not so good. Red definitely has a need, right? So he was only yellow in alpha lipoic acid, vitamin B1, magnesium, manganese, and digestive enzymes. Everything else was in green, healthy levels. Now, one thing that Genova with this lab, they will do suggested recommendations, and that's this little column to the right. And there is a place where if you want to download and put in provider recommendations, you can. I give their plan to them on a different sheet. But it does help you try to figure dosing a little bit because it'll say, well, based on his level of, example, vitamin B1, we recommend him to have 25 milligrams of vitamin B1 a day. Now, I don't give all of those vitamins separately because it's also really important, guys, in functional medicine not to overwhelm the patient or they'll quit the whole thing. They'll just quit. We're still human beings at the end of the day. So we can't give people 40 pills to take every day because they won't adhere to it. Maybe a couple would, but not most. But this helps me look at, should I do a B complex? Should I do a B1 alone? Should I do some trace minerals, maybe some magnesium and manganese alone? It helped me to make the choices, and we'll go over a treatment plan here in a second. But really, the metabolomics kind of shocked me because I thought we're going to see a whole bunch of deficiencies. No. What we saw and what functional medicine testing showed us was we had problems with the HPA-axis, right? So let's go talk a little bit more, though, about just some of the things we did see for his vitamin needs before I dive into how we address the HPA-axis. So when we look at his results, we did see a little bit of yellow and a little bit of red there, right? So actually, we'll stay back on the other one for a second. So sorry. Thanks. So the elevated vitamin B1, now this is especially relevant for fatigue and mood, and he has a need here. So thiamine is essential for mitochondrial energy production and glucose metabolism. When B1 demand is high, the brain and nervous system may struggle to generate adequate ATP. ATP is our quick energy. That's adenosine triphosphate. That's our quick energy. That's our first energy we use. And that can lead to mental fatigue, low motivation, brain fog, and depressive symptoms. And it can further activate HPA-axis problems. So even though his metabolomics looks great, There's some little areas to be addressed. Another area was that magnesium and manganese. Again, when the demand is elevated, patients often experience, get this, anxiety, sleep difficulty, muscle tension, and poor stress recovery. So when you think about those things, he was having all those things too. So remember, nothing in functional medicine or the human body is siloed. So these vitamin deficiencies were feeding into his HPA-axis problem, right? So we have to fix HPA-axis, but part of how we fix it is we thread the needle through these supplements. So we're going to get the rest of this kind of going in the right direction. He also had a need for digestive enzymes. And, if there is any problem with digestion, that can cause some neurotransmitter imbalance. You make more neurotransmitters in your gut than your brain, right? If you don't know it, you're going to learn it in this certification. So it is important that if they're saying, hey, he needs digestive enzymes, that I let him know about, hey, these are some suggestions we could do to help you out in this way. And then finally, he was a little imbalanced with his omega-3/6s. Now he scored a green, but it still showed he needed omega-3. That very first page had a yellow triangle pointing up, which means pointing down, he did not have enough omega-3. These tests are very long and lengthy, and they take a while to learn. There is a total of 14 pages here for this patient. But the gist of the story is what he was deficient in here. We did need to close those gaps. But with that said, the most really important thing that we'll talk about is the plan of how we treat the HPA-axis. So Dr. Tal, did you want to talk about the practical application first?
Yeah, so we're going to do before we go into Dr. Kim's treatment protocol, we'll just do a quick review on what steps do we take to put it all in together. So when you're seeing a patient and you're utilizing this approach, how can you quickly and more simply integrate it into your each meeting with a patient? So let's show the clinician's flow for integrative care. And we created this because we recognize that each provider could be in a different stage of their practice, and also each patient might be in a different stage of readiness to make the changes or go deeper into their health. Now, ideally, you are either learning functional medicine and learning more about the root causes, the epigenetic factors, and you're now starting to recognize those, right? That would be step one, really evaluating the epigenetic factors. What is it in the patient's environment, in their lifestyle, in their diet, in their exposure, in the food they're eating, in the internal environment like cellular function, gut health, gut microbiome integrity. There's like probably over close to 15 different factors that we look into in the program. But what is it that causing the dysfunction, right? Remember, dysfunction precedes the initial symptomatic presentation, and especially with patients with long-term chronic diseases, the dysfunction precedes I would say the subclinical, right? They might have antibodies, they might have neurological or neurotransmitter imbalance, and then they experience the symptoms, right? And more noticeable symptoms. So one is evaluate those factors. The second one is educating the patient. And then number three, that's something you can also integrate if you're in primary care and you're slowly transitioning out to functional medicine, or starting offer functional medicine, or in the phases of learning functional medicine, but you can start already applying those lifestyle strategies right away. So we have, for example, we have community members in our program that are integrating those simple strategies right away, even from their first month in the program. So step number three is, what is one actionable recommendation or strategy that your patient can start utilizing right away? So for me, for example, when I see patients that I know they need more movement, maybe I would ask if they can walk for 10-15 minutes after they eat lunch every day. The fourth one is dietary guidance. It's like one thing that they can do. What is it that I want to focus on? And Dr. Kim is going to give you an example but it could be even as simple as, can you add like a handful of like leafy green vegetables every day to your plate, right? All the way to, if they're more ready for a bigger change, maybe, okay, let's switch you to olive oil. Let's do this, right? We want to start shifting them to a more anti-inflammatory internal environment, right? But remember, like Dr. Kim said, it's better to sometimes start with like one or two simple recommendations than go give them like 15 different supplements and then they're not going to take it, right? Same thing with diet, same thing with lifestyle. You like one or two steps every time they see you is enough. And number 5 is the supplement strategy. We do teach a lot about supplements because with a lot of the factors that we deal with functional medicine, the dysfunction, there is no specific pharmaceutical to deal with that situation, right? And the phytonutrients that we learn in evidence-based or nutritional compounds that we talk about are very specific and targeted based on peer review studies, and they have very specific physiological impact. So if you want to optimize cellular function in a certain way, if you want to support the HPA-axis in a certain way, there's like strategies for every little thing. And Dr. Kim is going to show you the example of how that works. So Dr. Kim, take us into your functional and integrative plan and intervention.
Yes. So we can put that integrative treatment up if you like. The HPA-axis repair is what we needed to really focus in on for this patient. And so that integrative treatment, there was hormonal support morning and midday, and it really matched, if you remember back on his ASP profile, that black line that was just so high up, right? He's high with his cortisol. We need to treat that. You treat high cortisol different than low. So that's very important for you to know, just at the basic levels of this. How do you treat HPA-axis? If it's high, you treat it differently. I'll say that again than if it's low. Okay. His was high. There is a book I'm going to plug real quick. Maybe I should put this in chat, but I will say it slowly. It's The Role of Stress and the HPA-axis in Chronic Disease Management, Principles and Protocols for Healthcare Professionals. Again, that's The Role of Stress and the HPA-axis in Chronic Disease Management, Principles and Protocols for Healthcare Professionals, and it's by Thomas Gilliams. I'll put his name in chat really quick, just because I really like this book and I think it would be very helpful to you. Guilliams. Okay, there's his name. Then I'm going to put another name for you just to kind of, it's good to learn from a little bit of everywhere. And this is where I learned a lot, and also from our courses, about how to balance adrenals if they're high or low and what protocols to use. So I pretty much followed one of these protocols that have been very well studied. It's very well documented in the data on how to treat it. Kalish, there's a Dr. Kalish that has done a lot of work on hypopituitary axis. There it is. You're a genius. Thank you for showing that. Both Dr. Gilliams and Dr. Kalish have spent decades studying the HPA-axis and done a lot of work with Mayo Clinic. I think highly of Mayo Clinic. I did my residency there. I worked at Mayo Clinic for 10 years. So I'm like, I trust these guys. I know they know what they're talking about. I'm going to listen to this protocol. So without further ado, we'll go to what I did. So it's important to dose them at the times you measured them to try to get the opposite response. Now, why in the world would we give DHEA when he's already high? Well, guess what? His adrenals are trying, but it's not enough. He needs actually a teeny bit more, and this isn't forever. Usually these protocols average 3 to 6 months, and then you should see the patient reverse. It's the most miraculous thing. It's like it's like you're rebooting your computer. So they don't have to do this forever. They do this 3 to 6 months, then they stop for a couple weeks and we recheck. So he took DHEA in the morning. He took 4 drops, at lunchtime 4 drops. He took pregnenolone, morning 6 drops, lunchtime 6 drops. Fosarine is the name of the supplement I use, but it's phosphatidylserine. I use Fullscript. I love Fullscript. If you don't know much about it, write it down, check it out. It is a wonderful thing to use for your practice. It's a way I can give a supplement prescription to my patients. I have my own dispensary there. Again, there are other good places out there, but I like them and they have good brands. And you got to have a place to get good supplements. So anyway, he took the fosarine or phosphatidylserine at 100 milligrams when he woke up and 100 milligrams at lunchtime. Now, the reason why we're doing this is we are giving, and these are baby doses, guys. So these are literally like it's DHEA, little drops, pregnenolone drops. The DHEA, the pregnenolone, and the fosarine, it all helps to bring the cortisol down. So we know over time what we want to do is get him into that green level. And he was out in the white. He was above red, right? So we've got our work cut out. So that was his regimen. And then I also wanted to make sure that what we were working on, the things from the metabolomics. And he was already doing a multivitamin and a vitamin D. And I always ask patients, if I'm doing an HPA-axis repair on them, are you okay to handle the core supplements too? Because it does create quite a load, but you really will get a better response because remember, like I say, the supplements that he needed fed into this problem too, right? So I had him on a multivitamin daily, and I did the Pure Encapsulations 1 multivitamin. I like multivitamins now multivitamins, there's a lot of like, are they worth it? Are they not worth it? I have some of my favorite ones because I pick the groups of ingredients so the patient doesn't have to take, 14 pills. I like the one by Pure Encapsulations because it has a high amount of B, which he was low in. Had him still take his vitamin D3 with K2 at 5,000 units a day. He was like at 2,000 units. So I wanted to bump him up because I really wanted to get him to be between 60 and 80 nanograms per milliliter. Fish or krill oil, 1,000 milligrams a day to get those omega-3s up. A probiotic for daily gut support. CoQ10. Now that CoQ10 actually, is recommended for patients over age 35. Now, I'll tell you, I didn't do that one for him, but this is all the daily core supplements I would do if I had a patient look like this that was over age 35, because your body stops making as much CoQ10 as it needs after age 35. So I actually didn't have him on that one, but if your patient's over 35, I would have him on that one. And then alpha lipoic acid, 300 milligrams twice daily. Then his bedtime regimen was magnesium, and that's actually where he took the probiotic. So he didn't take the probiotic with the daily core supplement. But just know that these daily core supplements are really important for fixing HPA-axis as well. It all works together, okay? So went over that with you guys. The next thing I wanted to show you is his lifestyle. So the integrative treatment lifestyle. So it doesn't just stop at supplements, right? So the biggest thing we're doing is having him do the HPA reset with that regimen. Then I had him on supportive supplements. Next, I said, let's work on lifestyle. Now, this didn't all happen in one visit. We baby stepped it, but I'm giving you the full thing that we did after about 2 visits. He was up to doing all this. Journaling. So we got him doing some lifestyle journaling for a couple weeks. I wanted him to track what time of day he felt fatigued, brain fog, sleep was off, anxiety or depressive symptoms. And that was really informative for him because he found that, he was logging when his cortisol levels were the highest was when he felt the worst. So we're talking like morning, clear all the way through probably early afternoon was when he felt the worst. And that's when his cortisol levels were the highest. So I was able to make that correlation with him. And he was like, oh, wow, it does all work together. And it's really, I love journaling like that with patients so they can write down when things are happening, because then they'll see things line up, and it's a really good teaching point for them too. And believe it or not, even that journaling, even though he's tracking things, that's therapeutic, actually, because people are feeling like they're a part of fixing, what's going on. Medications, I had him continue his current medications. A psychiatrist was managing them. He didn't want to switch over to me for those yet. I'll tell you more in a second. Physical activity, I wanted him to spend at least 10 minutes, if he could, just outdoors in the morning and lunchtime. There is really good data to back up going outside, physically outside. You don't even necessarily have to be walking, but go outside and stand outside 5 to 10 minutes. If you can get your feet on the ground, that's even better. Very cortisol lowering. So very good for him to do this in the morning and at lunchtime when he can. And then I wanted him to eventually aim for 150 minutes a week of low impact exercising, like walking most days of the week, or low intensity strength training. And then sleep support, I just reviewed important basics with him. Like that hour before you go to bed is that really important hour. You want to dim the lights, you want to dim noise, you want to dim all stimulation of all kinds. If you're using a device, put it on that, like the warm or the night mode if you can. Ideally, stop using devices. Ideally shut yourself off from the electronics if you can in that hour before bed. If you can't, dim everything, quiet everything down. That's going to help you get that cortisol level even lower and help you release melatonin to get you sent off for a good sleep. So let's go to the follow-up. So he comes back, he's doing all of this stuff. I saw him probably 3 or 4 times during this time period, just checking in. And the 3-month follow-up, he told me, he's like, I can't believe how much better I feel. I have a lot more energy, more motivation. I'm actually like getting inspired for life and wanting to get out of bed. He said, I feel so good. I just quit taking my ADHD medicine. And I was like floored. Like I didn't expect that. That's part of the reason why I'm sharing the case though, because this is quite remarkable. But he's like, I just stopped it. I didn't feel like I needed it. And he was adhering to the regimen consistently. And then we rechecked the ASP profile. And I think we have that, the new profile we checked on him, would be like, get the next one down. There we go. Perfect. So we have made big progress in 3 months. So remember where the black line was, it was nearly at the top of the box, like nearly at like he was maxed out on his cortisol. And now things can happen in the afternoon. If they get a little stressed or they might get a little bump. He's not at green, but he is so much better than he was. And we haven't rechecked it the 3rd time, but he is reporting feeling so much better, and that cortisol level has greatly dropped. And now it's even doing something that looks like the slope, where it's higher in the morning and coming down to low. And at nighttime, he's almost in the green now. So he's really corrected that quite significantly. And so basically we're going to repeat. He's doing 3 more months of the regimen, and then we're going to repeat that 1 more time. Now, he had gone off all of the HPA reset supplements, so he was only taking core supplements and doing lifestyle for 2 weeks before we rechecked this HPA-axis. So this is not reflective of like same time dosing. Like he wasn't doing the repair anymore. He was pausing it for 2 weeks so we can measure where he's at. So that's where it's like rebooting a computer. It's miraculous. It gives your brain baby nudges into the right direction. So I thought this was just a really powerful example to show you. He has me managing his medication. He's not taking ADHD medication anymore. He's not even taking the as needed anxiety medication anymore. Still on the Wellbutrin, but we've pulled 2 meds off his list by correcting the HPA-axis. And, we're still working on it. So I'm very confident he's going to come down to that green level. And it's pretty amazing to do this. And otherwise, I think of if he had not come to functional medicine, where would he be? Trying all the different cocktails of medicine still, just trying to just get this kid better with medication after medication or different, not that therapies are bad. He still sees his therapist, but until you fix this stuff, it's going to stay the same. So I hope you enjoyed learning from that. Again, I highly recommend, if you want some deep dives into HPA-axis, looking up a couple of those authors. You're going to learn a lot at our academy about it as well. And that's the case.
Thank you so much, Dr. Kim. This was fascinating and amazing to see also the before and after. So I don't know if you guys remember that. Maybe Jacob can show that. But he was really high on the cortisol level. Like he was all the way up there, close to the top of the chart. Yeah, there it is. This was the first test. You can see the cortisol levels are they're at the top of the reference range. And
even the nighttime,
Yeah. And now look at that. That's much more aligned with the natural circadian. And then, of course, one thing to mention again is that we want them in the green area. That's optimal range.
Yeah.
So when you look at those charts, we want them in the green area. And you can see in the evening, Dr. Kim's protocol has kind of brought him very close to that, which is amazing. And then Dr. Kim, and this is something I wanted to mention as well. Dr. Kim is starting her. She's going to be teaching in the Functional Medicine Accelerator from January 5th. So this is the way to, if you want to dive deeper, you want to learn the entire functional medicine system. And really make 2026 your best year. Get great clinical outcome, even with those patients that sometimes other practitioners don't know what to do with them, right? Then I would highly recommend check out Dr. Kim's program. She's got a whole section, a whole module, and every week on each one of those concepts. So Dr. Kim, this is going to be a fascinating program. This is a 4 months certification program. That's why it's called Accelerator. So instead of kind of stretching the learning of functional medicine into like a year or two, we really condensed it using this system that we've been teaching for years, other practitioners, and giving you all the protocols. All the treatment protocols are in your phone, so you get a quick access. You got the clinical guides, you got the evaluation tool that you're getting, and just that phone, having the app in the phone and the clinical guides, and having Dr. Kim available to you to do a one-on-one for your patient, it's worth. I can tell you that I paid over. I went to programs that were over $30,000. There were 3 years, 2 years. They were very expensive, and I didn't get any of these resources. So just having somebody like Dr. Kim and Dr. Esha and Dr. Chill or other medical team members available to you to do a one-on-one and go over your patient's labs with you, all of that, then that's incredible. That's incredible by itself, and it's all included. Dr. Kim, you want to mention, you want to add anything to that about your program? I know that when I look at the curriculum, it looks like every week you really do like a deep dive into one concept, right?
Yeah, it's really, I love it. And I kind of wish I would have taken the one with the live session at the beginning, because what's so cool is you're going to get learning. You're going to get a week of learning all those 12 weeks. You'll be learning a lot, but it is paced out well. And the beautiful thing is Monday evening, you get introduced to that week's learning live, with me, and I'll set you up for, hey guys, this is what we're learning. This is what we're going to talk about this week. one of the weeks is the HPA-axis. So there's a new topic every week. There's 12, weeks of this, and you start on Monday with a live session. It's awesome because we're all together. We have some live Q&A, and then you're off and learning all week. And then we circle back the next Monday. And so then we'll kind of touch base on last week's stuff and then dive into the new content. So, having that live connection is, to me, and I've been in teaching formally since 2006, there's nothing quite like that live connection, and it's great to watch a pre-recorded lecture for sure. I don't want to put that down at all, but that live is just so important.
I absolutely agree. And I can share just from my experience. I went through 3 different programs out there. I did classes with, some classes with pretty much every school you have heard of. I was in class. I was taking classes or watching their on-demand recorded classes. But what I found to be really useful is once I actually had a mentor, because until you have a mentor and you are actually connecting with somebody like Dr. Kim, right? It's really hard when you're sitting. It's like Dr. Kim said, metabolomics, we teach metabolomics. We teach the whole 14 pages. We go into, I think it was week, I forgot, week or 9 or 10 that Dr. Kim, you're going into cellular function, all that stuff. And we also have amazing other practitioners. Dr. Allison is a functional medicine physician. He's teaching the cellular dysfunction as well. So we got amazing Dr. Caviola. We got amazing presenters. But I never forget when I learned these labs. But then the first time I got a patient and they brought in all these lab reports, I was like, oh my God! I was like, there's so much in there, right?
Yes.
Yeah, and even to the simplest questions like, what do I prioritize? Like, there's like, they got dysbiosis, they got this, I'm suspecting that. So having somebody that you can actually book a call with, we have a HIPAA compliant portal. You can share those labs, right, in private, securely, and you can ask questions for like 45 minutes to an hour, just going over like getting clarity. And it is, to me, in my opinion, worth more. And you get that for a whole year, which in my opinion is worth way more than the cost of the program even. So getting that and all the clinical tools. And for all of you who are in our program, in our functional medicine program, we invite you to book a call. It's included in your program. Book a call with Dr. Kim, Dr. Chill, Dr. Esha. We're all here for you. We're very much invested. You can tell how Dr. Kim is passionate about functional medicine. So we're very much in. Yeah. So, we're all here for you. Book the call because we want to help you. And sometimes I hear from practitioners, well, I'll just wait until I'm finished with all the classes. I'm like, my recommendation is book a call even for yourself from the first month. Like, you don't even need to have any labs. And to be honest with you, I had a lot of patients on like such a small budget, a lot of patients that couldn't even afford labs. And so in most cases, I would just use the evaluation tool, the functional medicine evaluation tool that you can download from a platform, fill it up, and you'll have all the signs and symptoms of the different root causes. Book a call for yourself, and you'll be surprised how much you learn about your body and what you can do for yourself to improve your health. So just do it. It's life-changing. I use all the principles for myself as well. And that's your vitality. Now, if you got a family member, friend that you want to use the coaching call, a mentorship call do it. I mean, a functional medicine practitioner charges hundreds of dollars. So you can save a lot of money just by utilizing those coaching calls for that. So, Dr. Kim, I really appreciate everything that you bring into us, the experience, your training, your passion to help others. I really appreciate it. And
appreciate Dr. Kim, you right back. So thank you.
Yeah, thank you so much. And Dr. Kim is starting with her class in January 5th. So we're going to have an amazing holiday. We're going to, hopefully all of you are going to spend time with your families and have fun and enjoy. And then we're starting 2026. going into functional medicine, and you're going to get certified in 4 months, which is pretty awesome. So that's the accelerator. And then if you want a more comprehensive training, then we have the functional medicine mastery. But I like the approach of like 4 months, you dive deeper, you learn the whole system, and now you get certified, you can use everything. I feel like that's a really good approach without spending like, another, 15, 20, 30 or $40,000 on another very expensive degree or something like that, right? So that gets you right into the clinical labs and functional medicine analysis and all the treatment protocols. So that's going to be awesome. I hope to see all of you there. And of course, next week is the holiday, so we're not going to have a Wednesday class. But by the way, first, we got asked before about what if I miss one of the Monday night class. So these are all recorded for you, just for you to know. If you miss one of the classes, it's all recorded for you. Dr. Kim also we're going to upload that and the handout. So that's all going to be there. I see there's a question here about the cost of labs versus out of pocket versus insurance. Do you want to?
I'll be so fast because I know you guys, I want to honor your time.
Yes.
But we have several different labs we use. So if somebody wants to use insurance with us, we go with LabCorp. If they want to use cash pay and it's a blood draw lab, we use Ulta Lab. Those are two that are available to you. Now, I always tell them if they want to use their insurance, I'll give you an example of vitamin D. They will charge the insurance. They will charge the patient and the patient's insurance $250 to run a vitamin D. If I order it through Ulta Lab, which is my cash lab, it is $22.
Mm-hmm. Yeah.
So a lot of my patients have insurance, but they choose to use HSA or pay cash to see me and for labs. Now I'm direct pay for visits. I don't do insurance for visits, but I let them if they want to use insurance for their labs. And most of them, I would say 98% do the cash labs. So I can run a full panel for around $200. That includes hormones, all the blood work we need. Or it would be like $1,200 or $1,300 if they use insurance. Now, let's talk about real fast, just functional medicine labs. Insurance, you can turn it into insurance if you want to. Genova has that option for patients. I let the patients pick. A lot of times insurance won't pay for the functional medicine labs, and those range in price. Our highest ones are like the GIFX and metabolomics, and they're around like $439 right now. Now some clinics will add on extra fees and take, a little extra on top of that if you get the kit at the clinic, et cetera, et cetera. We do charge a reading fee for those. I hope that wasn't too long. I could tell you a lot more, but I hope that makes sense.
Yeah, that's great. And by the way, Dr. Kim is gonna, for every week that she goes into like gut integrity, or 1 week gut microbiome or mitochondrial dysfunction, whatever it is, every week, just an example, she's gonna talk about some of those labs and where do you get this lab or that lab. So if you're asking yourself like, well, where do I get this? Or don't worry about it. Like we even have like a clinical guide for labs that have like specifically if it's a patient that wants to order their own labs, maybe you're seeing a patient from out of state and you're not licensed there or whatever it is, we have different clinical reference and resources that you can utilize for yourself, because patients today can also order their own labs. So if you have a virtual practice, you can order it for them. But today there's also like even Genova has Genova Connect. Yep. Online. Patients can order those labs for themselves. So if you don't want to deal with the labs, the ordering, the handling, like just let the patient order their own labs. That's another option. We also seen registered nurses that take that more like nursing coaching approach, and they don't order the labs, so they don't do primary care. So they don't want to cross any scope of practice or anything like that. So they just tell the patient, listen, based on your symptom signs, the presentation you come in with, I would recommend you to look into this lab. This is where you get it. You can order it online and share it with your primary care provider, which in most cases they won't know what to do with it. But
right.
But we do that. I mean, our practice was not we had physicians, nurse practitioners, and nutritionists, all of that. We chose not to do primary care at all. So every time a patient comes in, we're like, okay, here's the labs that we would recommend, and then share the results with your primary care practitioner. And then they always come back and say, my primary care practitioner told me to just keep on the work that whatever you guys doing with that. That was the response. Typically, it would be like, okay, just they would look at it and they don't understand it, so they're like, well, just go back to Tal and keep on doing what you're doing, right? It's like that's the typical response. So, but that's okay. You can get the patient to order their own labs, and like Dr. Kim said, with doctors' data and Genova Diagnostics, there are billing codes. So if the patient really wants to use the insurance, just bill the insurance. So you can do that. If it's going to get covered, it also depends on their plan, and there's like and deductible. I've seen so many patients now with like $8,000 deductible, which in my opinion is just robbery.
Crazy.
But but that's like a whole different story. That's why that's why we also teach you how to have an option for a cash service, which thank you so much, Dr. Kim. I really appreciate it. Thank all of you for being here.
Thanks,
I want to thank our media team and Jacob for putting this all together. And I hope you have a happy holiday. Enjoy with your family. And we will see you in the next class.
Bye, everyone.